Pulmonary examination. For best results, examine the posterior thorax and lungs while the patient is sitting and the anterior thorax and lungs with the patient supine. Begin with inspection, then palpate, percuss, and auscultate. The patient's arms should be folded across the chest with hands resting. This position swings the scapulae laterally and increases access to the lung field. Inspection. Standing behind the patient, note the shape and how the chest moves. Look for any deformities or asymmetry in chest expansion, abnormal muscle movements on one or both sides. Palpation. Identify tender areas. Carefully palpate any area where the patient reports pain or has visible lesions or bruises. Look for skin abnormalities such as scars, lesions, and masses. As you position your hand, slide them immediately just enough to raise a loose fold of skin between your thumbs over the spine. Ask the patient to inhale deeply. Watch the distance between your thumbs as they move apart during inspiration and feel for the range and symmetry of the rib cage as it expands and contracts. Percussion is one of the most important techniques of physical examination. It helps identify if the tissues are air-filled, fluid-filled, or consolidated. Hyperextend the middle finger of your left hand, known as the fleximeter finger. Press it firmly on the lung surface. Note that other fingers are not touching the chest wall. With a quick, sharp but relaxed wrist motion, strike the finger with the right middle finger, known as the flexor finger. Strike using the tip, not the finger pad. Short fingernails are recommended to avoid injuring your knuckles. Palpate both lungs for symmetric tactile fremitus. Fremitus refers to the palpable vibrations that are transmitted to the chest wall as the patient is speaking and is normally equal. To detect fremitus, use the ulnar surface of your hand. Ask the patient to repeat the words 99. Use both hands to palpate and compare symmetric areas in the lungs in the pattern shown in the photograph. Auscultation. Auscultation is the most important examination technique for assessing airflow. It involves listening to the air sounds during breathing. Abnormal sounds. Before beginning auscultation, ask the patient to cough twice to clear airways. Always place the stethoscope directly on the skin. Clothing alters the characteristics of the breath sounds and can introduce friction and other sounds. Examination of the anterior chest. Inspection. Observe the shape of the patient's chest and movement of the chest wall. Notice for any asymmetry in chest expansion, abnormal muscle retraction, and impaired respiratory movement on one or both sides. Palpation. Place your thumbs along each costal margin, your hands along with the lateral rib cage. As you position your hands, slide them immediately a bit to raise loose skin folds between your thumbs. Ask the patient to inhale deeply. Observe how far your thumbs move as the thorax expands and feel for the extent and symmetry of respiratory movement. Percussion. Percuss the anterior and lateral chest, again comparing both sides. Auscultation. Listen to the chest anteriorly and laterally as the patient breathes with mouth open and somewhat more deeply than normal. Compare symmetric areas of the lungs using same pattern for percussion.